Welcome to Med Madness, where we delve into the fascinating world of medical science to help you ace your exams and deepen your understanding. In today's episode, we will explore hormone receptors, an essential topic for understanding how our bodies respond to various signals. We'll cover intracellular and surface receptors, their mechanisms, and their roles in regulating physiological processes. Next, let's discuss intracellular receptors. Intracellular receptors are located either in the cytoplasm or the nucleus of a cell. These receptors bind to steroid hormones, thyroid hormones, and fat-soluble vitamins. When a ligand such as cortisol, aldosterone, or progesterone binds to its receptor in the cytoplasm, the receptor-ligand complex translocates to the nucleus. Here it binds to specific DNA sequences known as hormone response elements in the promoter region of target genes, altering gene transcription. Next, let's discuss an example. For instance, the progesterone receptor binds to DNA after the ligand binds in the cytoplasm and then moves into the nucleus. In contrast, receptors for thyroid hormone and vitamins A and D are always located within the nucleus, ready to interact with DNA once activated. Next, we move on to surface receptors. Surface receptors are embedded in the cell membrane and include G's protein-coupled receptors, JAK-STAT pathway receptors, and tyrosine kinase receptors. These receptors trigger various intracellular signaling pathways upon ligand binding. G's protein-coupled receptors include examples like receptors for parathyroid hormone and glucagon. Binding of the ligand to these receptors activates adenylyl cyclase, increasing intracellular cyclic AMP, CAMP levels. JAK-STAT pathway receptors include the growth hormone receptor, which, upon activation, triggers the JAK-STAT signaling pathway, leading to changes in gene expression. Tyrosine kinase receptors, including those for insulin and insulin-like growth factor 1, IGF-1, have intrinsic tyrosine kinase activity. Ligand binding leads to autophosphorylation of tyrosine residues, initiating downstream signaling pathways. Consider a real-life case study. For example, consider a patient with Addison's disease, a condition characterized by low cortisol levels. To manage this, the patient is prescribed corticosteroids. These drugs bind to intracellular glucocorticoid receptors in the cytoplasm. The receptor-ligand complex then translocates to the nucleus, where it binds to specific DNA sequences to regulate gene expression, thereby helping to control inflammation and immune responses in the patient. In conclusion, today we covered the fundamentals of hormone receptors, including their locations, types, and mechanisms. Understanding these concepts is crucial for grasping how hormonal signals regulate various physiological processes. We encourage you to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards we've prepared. These tools will help reinforce your learning and ensure you grasp the key points effectively. Stay tuned for our next episode, where we'll continue exploring more exciting topics in medical science. Thank you for listening to Med Madness.